If somebody has shoulder replacement, how long does the surgery take?
The surgery usually takes about an hour and 15 minutes.
And with that, you have to cut off the ball, and you have to put in a new ball, and then you have to put in a new socket, and then you sew everything back up. What's the shoulder feel like when you're recovering?
You know, it's very interesting. Most of the time in the recovery room, we'll offer patients what's called an inner scalene block. That's where we numb up the arm by putting some anesthetic here in the neck. And only about 50% of patients actually need it. I think it's because they've had so much pain for so long that they feel relief once you get both sides of the joint resurfaced. And the techniques that we have now are much different than what we had before. And so we've developed some instrumentation that allows us to do this operation with a lot less collateral damage to the tissue.
So by instrumentation, I would think, a non-surgeon, you mean things that expose the shoulder, let you operate with less trauma getting in there.
Exactly. You try to get in a stealth fashion and get out. And what we do have to do is cut the front rotator cuff tendon or remove the bone that the front rotator cuff tendon is attached to in order to open up the shoulder like a book and then close it back when we get done.
So is that easy? When you close it back up, you've got to sew up that tendon or muscle.
Absolutely.
So is that the biggest part of recovery?
That is the biggest part of recovery right there. And then maintaining the range of motion. So what we do after the surgery is we try to maintain the range of motion that we get in the operating room. So we can move the shoulder all different kinds of way in the operating room, and so that's what we want to do after surgery, but we want to protect that repair.
So if somebody's a sissy and doesn't want to move their shoulder, you say you got to move the shoulder.
Got to move the shoulder.
So you got to have physical therapy after the shoulder surgery.
Yes, sir.
Well, what's it like a month after, 2 months after, 3 months after? How long does it take?
It takes about 3 months, and then I release patients to go ahead and start playing golf. Now, a lot of them will start chipping, and they certainly start putting a lot earlier than that. But typically, this is the normal timeline. At 2 weeks, you come back and we take the suture out, but you're able to do waist level activities right away.
So what's waist level activity? What do you mean, like what?
Typing and writing, preparing sandwiches, you know, taking care of personal hygiene issues. You can do that. You can get to your face. You can get to your brush your teeth.
But you can't pick somebody up or something like that?
No, you can't pick anyone up. Can't pick anyone up.
Okay.
But for the first 6 weeks, you're in a sling when you go out away from the home. While you're at home, you don't even have to be in the sling. You just need to make sure that you don't reach up or out. You just keep your worlds kind of confined to the waist level activities for the first 6 weeks.
Does this patient at about 1 month, do they need physical therapy that's professional, or do you give them exercises at home to walk up a wall and do things?
We typically do a combination of both. The therapist is there to coach them along, and I think it's important for patients to have a coach so they can see that person intermittently once a week. So we start the therapy within the first few days of surgery.
Is that a fact? At 2 months and 3 months, 3 months you're going to let them play golf. When am I going to be able to do a push-up?
Push-up, typically around 3 or 4 months is when I'm going to let you do that.
Okay. And when do you say, okay, I don't want to see you anymore, you can do anything you want?
I like to follow them every year just to get x-rays.
What's it usually like at 6 months?
6 months, you're working out in the gym.
Throw a ball?
You know, I've got several patients that are throwing balls. I've got a video of one patient that's throwing a baseball because that's what he used to do. He used to pitch.
So he really longed for doing that thing he'd always done.
That's what he wanted to do with his
grandkids. Did he have a good shoulder motion when he threw that baseball?
He actually looked pretty good. I don't think he played in the professionals anymore, but he looked pretty good.
But you could go out to a lake and skip a rock and
you can certainly
throw something and back to. Does the shoulder crunch?
The whole goal is to get them back to doing the things that they want to do.
Yeah.
And so the only limitation I really place on patients, because I think this is where this is going, is I don't want you bench pressing any more than your weight. So the guys especially that we replace, most of them want to get back to the gym. And so I'd love for them to get back to the gym. I'd love for them to play tennis. And at 3 months, I want you taking some ground strokes. At 6 months, that's when you'd be serving, okay? And so there's a gradual progression of doing things that are more waist level to mid-level to overhead. And you just gradually start working those things in.